Good evening, everyone, and thank you for joining us tonight. If this is your first time joining us for the Pharmacist program, we'd like to welcome you to the program. And if you are coming back once again, thank you so much for coming back. We cannot wait to have you a part of the program. As always, before we get started, I would like to read this brief disclaimer that you see on your screen, and that disclaimer is this. The Pharmacist virtual learning experience, brought to you by Mandell's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandell's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I want to welcome you once again to the Pharmacist Virtual Learning Experience, an educational program created by Mandell's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. My name is Craig Orapello, and I will be your host tonight. As always, the Pharmacist program takes place every Monday night at 7 p.m. Eastern Standard Time. Normally, we will be providing a live medication instructional program on 3 fertility products, including interactive Q&A throughout the program. But tonight, we're going to do something a little bit different. We're going to do a best of type program where we're going to show you some of the best interactions we've had with our outstanding pharmacist nurses over the past few months. So you're going to get a chance to hear from our nurses talk about 3 different fertility products, and you'll get to hear the Q&A that took place throughout that program. And then we're going to wrap it up with something just a little bit different, but very, very special, very important. We're going to get to hear part of our Behind the Shots program. And so you will hear from one of our nurses who will share her story about why she got into the fertility business in the first place. So it's going to be a very interesting program tonight. You will get to hear 3 excellent products and then get to hear a very personal story that can share some support for you in what you're going through and get a chance to hear what some of these nurses are going through on a day-to-day basis. So as always, the program will be back next Monday at 7 p.m. But for tonight, I want you to just get ready and listen to some excellent interactions with some of our outstanding pharmacist nurses. And with all that being said, I want to take a little chance to turn it over to Caitlin to get started with our first product. So thank you so much for joining us tonight. Enjoy the program and take it away, Caitlin.
In order to inject the Gonal-F ReadyJect pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonal-F pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So I always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, that's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen, so anywhere that you can pinch an inch of skin in the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15-30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. Yes. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you will actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your gonal F pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the gonal F pen. This one is a nice one to start with because it's pre-filled, ready to go. It doesn't require any mixing of medications. And usually this is one of the first medications that patients start with during an IVF cycle. So it is nice to start out with this one. It's typically well tolerated and pretty straightforward in terms of administration preparation. So with that being said, any questions out there yet?
Hey, Caitlin, how's it going? All right. So we do have a bunch of different questions out there. And just a quick reminder for everybody, if you are joining us in Facebook, you can just type directly into the chat. And if you're joining us via the Zoom, you can type either into the Q&A or into the chat function, and we will get it both ways. Obviously, some of you have already figured that out because some questions are coming in. So here comes the first question, Caitlin. This is a great place to start, just kind of top line overview. Is FSH the most important part of the cycle? What does it actually do?
Yes, very good first question. So, you know, of course, this is opinion. I tend to argue that every medication is just as important as, you know, the one before or after, and to take them all very seriously. They all have their importance in getting to our goal at the end of your cycle. So they each have their own job to do, but the gonal F specifically is FSH, which stands for follicle stimulating hormone. So it's actually doing just that. If you break it down, remember that in an IVF cycle, our goal is to retrieve as many eggs as possible. So during the cycle, the eggs grow within follicles. The follicles are within the ovary. So the gonal F is quite literally sending the signal with this hormone to stimulate the growth of those follicles, ultimately growing the eggs within them, right? So this medication is definitely important in the success of your cycle and maximizing the amount of eggs, you know, that you can get at retrieval. So, you know, a good way to remember what this one is doing is remember what FSH stands for, follicle stimulating hormone. It's stimulating the growth of the follicles and eggs through the cycle. So yes, very good question.
Great. Thank you. That's a great answer. And I like how you were very kind to all the medications. You can't choose your favorite. You said they're all very important. And that's the perfect way to handle this. So thank you for that great question. That was awesome. So this comes in, and this is more of a getting away from the top line stuff of how do the medications work, but sometimes we just kind of want to know about the presentations themselves and how we use them. And so this question that comes in, it says, I've heard that there is both a vial and a pen. Is there a difference between the pen and the vial? Does it matter which one I take? Can I use them interchangeably?
Great question. So yes, there is a vial for gonal F. So the medications themselves are the same. The type of injection is the same. They're both subcutaneous. That small 1/2-inch needle that goes into the fatty tissue, that part stays the same. Now the difference is how it's packaged and presented. So as you know, the pen is pre-filled, ready to go, no mixing. You put on that needle cap, dial up your dose, and inject. So the difference there is that the vial requires you to reconstitute or mix water into a vial of powder. At that point, that powder dissolves into the water, and then you actually draw up out of the vial your dose for the day. So typically with the two options, either maybe your clinic has a preference as to which one they want you to use, or they may leave it up to, patient preference. So if you have a strong, feeling one or the other, I know in my clinic, we're fine either way. If you have a strong preference towards one versus the other, we're also okay with if you need to use both within the same cycle, fine with that too. But ultimately, that would be a call that's made by your clinic. But, the general answer, it's the same medications, just delivered to you in a different way.
Perfect. Thank you very much. And I know sometimes people get a little bit, part of this whole program is to alleviate a lot of your fears and your nerves and some of those things that are, we know are going to happen, but we want to make sure that they can go away before you have to give that first shot. And so sometimes when you see different medications that are available and why did I choose this one over that one and things like that, it's good for us to be able to really put some of those pre-shot jitters to rest. And so thank you so much, Caitlin, for that. But yeah, it does not matter. You have a couple of options out there, and that's what you come to us for, is so that we can walk you through all the different products that are available and how they're going to work for you. So here comes the next question that says, all right, now this is one I know you've actually answered this on the show before, and this comes up almost weekly. This is kind of a general question for people with the multiple shot situation. And so the question says, if I know that I don't have enough left in the pen to give my full shot before I give it, how should I approach or handle that situation?
Yes, you are right. This is a popular one, and for good reason. So if you are looking at your chamber and you can tell that you're not going to have enough to get your full dose, your plunger's way up here, you have two options here. At this point, you can discard that pen, open a new one, start fresh. Or you can choose to use the overfill of the pen, which is what I recommend. This is a way to get the most bang for your buck. You can finish out that pen and whatever's left in it, as long as you don't mind having to do 2 subcutaneous injections in order to get your full dose. So how you do that is, even though by looking at your chamber and the plunger's almost, flush to the top, but there's a little bit of medication left, you don't have your full dose, you're still going to dial up your full dose in this window. So say it looks like I only have 75 units left in this, but my dose is 150. I'm still going to dial up to 150, just like normal, inject that medication, press your plunger down, watch it go down, but this time it's not going to go all the way to 0 in your window. But you'll look at your plunger and it's totally flush. There's no more liquid. There's no more medication left in there. At this point, you pull out the pen with the needle on it. That injection's over. And then whatever number is left in this window is what you will dial up on a new pen that you open. So it does the math for you. You do not need to subtract anything. Whatever number is left in here, dial it up on your new pen, put the needle cap on, and inject. So like I said, highly recommend using your pens until they're completely out, as long as you don't mind doing 2 subcutaneous injections for that dose in order to get them all. Very good question. Very common one I hear.
Perfect. Thank you very much. And I can say on behalf of everyone out there listening that anything that does the math for you is probably phenomenal. So I can, barely do math now without my calculator on my cell phone. So that works out really well, making it easy. That's what we're trying to do here. Perfect. So now we have a question, and this is a little bit more, hopefully this is not going to happen because everyone's going to know and they're have listened to you and they're going to have listened to their nurse at their clinic and their physician and know when they're supposed to be giving their different shots and so forth. But let's just say, hypothetically speaking, if this happens, question comes in, what should I do if I miss a shot of my FSH?
Yes. So This ultimately will be your clinic and provider's decision as to how to move forward with this. Typically, it depends on the timing of when you missed it. So if you notice that, you notice that the next day that you missed that night's dose, definitely contact your clinic, see if they just want to document, missed this part of the dose and move on as normal, or if they want you to take a little bit extra to make up for it. Every clinic is going to have their own preference when it comes to that. If you're a few hours late, typically I recommend my patients just take it when they remember it. But if you're looking at, a whole day later, a whole 12 hours later, something like that, I would recommend checking in with your nurse or provider to see how they would like to navigate that. And something that we do too when the cycle is complete typically is we add up how much FSH did you take during the cycle. So definitely communicate that to your treatment team so that they can account for any missed doses and if they want you to make up for those doses.
Perfect. Thank you very much. And I know that's a thing that a lot of people are probably a little bit nervous about, just the anticipation of potentially missing a shot. But a lot of this is once you kind of get into the flow of it, and especially nowadays with all of the different reminders you can put on your phone, or you can, if you have an Alexa, I'll whisper it because I don't want to set off anybody's that listening at home. But if you have one of those, if you have your Facebook portal or one of these things where you can ask it to set reminders, those are all great ways to really make sure that you don't miss those shots. But it's also good to have a plan. So thank you so much, Caitlin, for helping out with that one. And with that being said, we are all caught up right now on the questions that have come through. I do know, again, I want to remind everybody, it's not like once we move to the next product, you're out of luck to ask your questions. We'll be able to answer questions about anything that we talk about today. But let's give people like another 30 seconds if they're in the middle of typing something in. I'll throw it back over to you and we can check to see if any questions come in before we get ready to move on to the next product.
Great. One thing too with the question about missing a shot or a dose, it's not ideal by any means, right? We time these things precisely and give you precise dosages based on history and things like that. But ultimately, if you forget one dose, generally speaking, it's not like your whole cycle is canceled or anything, at least where I work. It's not going to absolutely break your cycle. So definitely not, encouraged by any means. Make it part of your daily routine. It helps you remember. But I also don't want to cause any panic in that sense. We don't want you to miss it, but ultimately, it's not going to completely ruin everything typically. So, kind of rest assured that, people make mistakes and it won't completely ruin your cycle by any means.
Your healthcare provider has recommended that you take progesterone and oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone and oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication, The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to 1 line or 2 to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it just 1 time. We know you're already clean. Just wipe it 1 time, separate the tissue, remove the top from the needle, put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil.
So see, that one wasn't so bad. You can do that with no problem at all. I do have lots of patients that worry about giving these shots because the needle is longer. But remember, you need that longer needle because it's going into the muscle. If you remember back to the last video with the Gonal-F pen, I said to bunch up the area where you're going to give it because you want to make sure you give it into fat. But this, you actually want to hold and separate the tissue so that it can go directly into the muscle. You want it to go deep down into the muscle. Since it's an oil-based preparation, it's not absorbed well in fat. You want it absorbed in muscle, and that's a really nice big muscle if you give it in your hip like that. If it does leak into fat, it might cause some little lumps or bumps or even redness or tenderness. If that happens, you just want to avoid that particular site and either go above or below or just to the other side. And whoever's giving your injection, make sure they know that you can tell how much they love you if they put the needle all the way in as far as it'll go. Craig, what questions do we have?
I just mostly love every single time that you say it's only instant death on, on the soap operas. It's still funny to me every single time. So yeah, this one we usually do get quite a bit of questions just because the nature of the injection itself and how it's done and the difference between this one and other ones. So some of this stuff you may have touched on a little bit in what you just explained, but these questions were coming in kind of during the video, so I'll just get them out there to you. So first one says, and we get this all the time, so I'm nervous about giving an intramuscular shot. How do I know if I missed the muscle, and can that be dangerous? What do I need to do?
Great question. And that's a very common question I get too. What I do with my patients, and I bet your provider will do this for you too if they don't already do it, is we will put our hand on our hip and show you exactly where those injections go. But I always draw a target on the hip. I take a Sharpie or a surgical skin pin and I draw parentheses on either side of the hip. Most men are good at hitting targets, except for sometimes the toilet. But usually if you draw a little target there and whoever's given your injection knows to go anywhere in that target when given the injection, then they're going to feel a lot more comfortable and you're going to be a lot less worried knowing if they're putting it in the right place. So like I said, I just draw parentheses on each side of the hips, so you'll know exactly where it should be given. And after a few days, when that starts to wear off, just have a Sharpie nearby so you can redraw those targets on there. Pretty soon, whoever's giving you the injections will go right to the place and not have any problems at all. Once in a while, we do see a little bit of blood leak out. Keep in mind with any injection, you're going through the skin and through tissue, and our bodies are filled with blood in all of our tissues. So if you have a little blood leak out, that's not a problem. Just put a little pressure there. If you see a little medication leak out, some people say they'll see a couple of drops of the oil leak out. That's not a problem either, because the amount that might leak out is just such a small fraction of the amount of medication that you've been prescribed. And finally, if you put that little bit of air, just a couple of lines worth on the syringe of air in with the medication, that air is going to go in last and it kind of seals it in the muscle. And I, in my heart of hearts, believe that causes that keeps people from having reaction, that causes the injections to be much easier and much better tolerated. Another question that I commonly get while Craig is waiting to get some questions is, what if I'm allergic to peanuts? And I said it may be in peanut oil. Any allergies that you have, you want to be sure and tell your provider, as well as tell the pharmacist or your coordinator at Mandell's what you might be allergic to. There are other formulations. It's most commonly sesame oil that it's in. It can be in peanut oil, but it can also be compounded. And Mandell's Clinical Pharmacy is a certified compounding pharmacy where they can mix it up with even oils like olive oil, something that we know that you're less likely to be allergic to, that you've not had problems with before. Another type of formulation is ethyl oleate. That oil is a little bit thinner, but different providers have very strong feelings as to whether they like that as well or not. So ask your healthcare provider, especially if you have allergies, to make sure that they order a formulation that is going to be most suitable for you. Other questions?
Yep, definitely. Okay, so we got a couple coming in, and thank you. You covered a lot. So some of these questions may have a little bit to do with some of the things you just covered there because they came in beforehand, but we'll get through just to make sure that everyone gets a chance to ask. A little bit of what you touched on was the just general kind of issues that could happen with these shots, like the leaking and so forth. But a little bit more specific that somebody said is, what side effects are associated with an intramuscular shot that may be different than your sub-Q shots, and how can I treat after the fact or avoid before the fact them altogether?
Great questions. Again, I think people are just really intimidated seeing that longer needle and think it must be a lot worse. The things you want to look for especially with progesterone and oil, would be tenderness or redness or local irritation. That's most commonly from the needle not going in all the way, where the medicine is in fat as opposed to in muscle. There are a couple of other things you can do to make sure that the injections are as easy as possible. One of them is to put heat on the area, maybe with a heating pad. We're going to talk about a patch in just a few minutes that you may have the option to order with the rest of your medications from the pharmacy. Personally, I prefer that people not use cold, because you know what happens if you put oil in the refrigerator, it's going to get even thicker. I keep sesame oil in my refrigerator here at home, and I have to let it sit out for a little bit to temper, so I can even get it out of the container. So do the same thing with that. Certainly you don't want to put this medication in the refrigerator. And I would think it would be a little bit more uncomfortable if you ice the area. So if you're going to do anything, just do heat. Whoever is giving your injection needs to make sure they put the needle straight in, all the way in. And the plunger is a little bit harder to press since it is an oil-based medicine and it's a relatively small needle. So they just need to be patient with it. It's interesting, what I found is that most of the time, whoever is giving the injection is much more stressed out about it than who is receiving the injection. Most of the patients, after they take the injection, they're pleasantly surprised how easy it is. And I have lots of patients, probably a quarter of my patients give their own progesterone and oil injections. So if they can do it with the big needle, having somebody with a longer needle, I should say, if they can do it on their own, then for those of us that would have a partner or someone to help them out with it, that's makes it even easier still.
Perfect. And this is all, again, part of the process of getting comfortable beforehand. So by the time you're ready to give that shot, you're not stressed out about it. And that's why all these great ideas that Karen's giving in terms of how to get used to it, how to get comfortable with it, how to prevent in advance any potential issues. These are all things, while you have the time, hang out right now and learn and figure it out. And then you'll be good to go when you have to give that shot. So thank you so much, Karen. That is very helpful. And to your point, we know a lot of people ask probably some of the most amount of questions, the highest volume of questions comes in about this product specifically because either people hear things about it or they Google things. And we always recommend don't use Dr. Google, but come in here and ask those questions. But hopefully we're putting some of that stuff to rest and putting you at ease. So speaking of this question, in terms of people being a little bit nervous and want to get this stuff out of the way. So it says, what happens if I miss a shot of my progesterone and oil?
Great question. So you wonder, you think, how can I possibly miss an injection? You've been prescribed these medicines. You're probably going through some time-consuming intensive fertility treatments when you're prescribed these medications. We're all human. We all forget things. Time gets away with us. Some of the things that I do to try to keep people in the habit of taking their medicines, as I say, pick a time and stick with it. Sometimes your provider will say, take your medications at this time or around this time. Whatever time it is, pick it and kind of stick with it and incorporate that into your usual routine. So hopefully you won't forget it. If you do, what I would tell my patients is don't beat yourself up over it. Instead, when you remember it, go ahead and take it. If you're supposed to take it at night and you don't realize it until lunchtime the next day, then I'd probably say call your provider and ask what they recommend. I would probably just say forego that dosage and just take the next one at the right time. When we give these medicines, it's kind of a fine line in making sure you have the perfect amount without having too much or too little. But nevertheless, they're still forgiving. So if you're running a few hours late, that's not a problem. If it goes into 12 or 20 hours, then just check in with your provider. We're always happy to answer any questions that you have about your medicines. We don't want you to fret about this. I have had some people forget to take it for a few days, and they still do just fine. I certainly don't recommend that, We want everything to be as perfect as we can, but we're all human and these kind of things happen. I've also had somebody decide she was going to take it twice a day. The only big drawback to that was her hips didn't really appreciate it, taking it 2 times a day. She was having to pretty much give a shot in both sides of her hip every day. So some providers may recommend that for specific patients, but just try to do your best to try to pick a time, stick with it, and incorporate that into your routine.
And we do actually mention quite a bit on these, on the Pharmacist programs, that one of the things is we live in a age now where we have a million different things that can have a reminder for us, like whether it's your phone or your watch or you have a little speaker sitting next to every desk in every room in your house or something like that, depending on how much you like that kind of stuff, that you can just say, give me a reminder at such and such time every single day. And that's a perfect way to always just remind yourself, just have it pop up on your phone right away. And then that you'll have a better chance of remembering than just trying to, utilize just the brain for memory, which I can't do anymore. I definitely have to rely on all of the technology in my house to remind me of things. So thank you so much for that, Karen. It really does put, I think, a lot of people at ease, understanding, worst case scenarios, best case scenarios, and then where we're all going to live is somewhere in the middle. So great. And with that being said, we are all caught up with questions. So what I'm going to do is I will, as always, I'll throw it back to you. Let's just give another 30 seconds or so for everybody to get any questions they may have. Again, remember, you can ask them at the end, but if you have anything, now's the time to ask before we move on to the next product. So back to you, Karen.
Perfect. All righty. Thank you. So if you've been prescribed progesterone and oil, don't fret over it. There are lots of resources for you, certainly your provider, these videos with the Pharmacist program, the folks at Mandell's Clinical Pharmacy. It's kind of interesting to me. I take care of a unique group of patients that have started up their own Facebook support group for the treatment that I offer. And it's fun to, they've invited me to participate in this group. And I tell them I won't read it unless they tag me on something. And this particular IVF series that I'm in right now, I've had a lot of people administer their own progesterone and oil injections and tag me on the post and ask me if they did it right. So there are lots of ways to communicate with your provider and with the pharmacy. So take advantage of all of those things and have faith in yourself. You can do this. Other people have done it before you. Other people will do it after you. I tell people after they do their first injection, they'll be the one out in the waiting room telling folks how easy it is. You'll be pleasantly disappointed that it goes so much better than you'll think.
This video is to help you with the mixing and administration of your Menipure injection. Menipure will come to you from the pharmacy in a box, a couple different boxes. They may be a little bigger than this, but this is right now what the box looks like, just in case you're wondering what it looks like and you have it at home. So you want to get that box from your safe place. It does not need to be refrigerated, so you may have this just in a cabinet, which is great. That's fine. If it's in the fridge, it's not wrong either, but it doesn't need to be in the refrigerator, just so that you know. The supplies that you'll need from, oh, nope, I'm going to rewind that before I jump ahead of myself, just to let you know what Menipure is. Menipure contains the hormones of FSH and LH, and both of those hormones work in harmony with our body, again, to help with recruitment and development of multiple follicles, which turn into multiple eggs for possibly insemination or for IVF retrieval. So the Menipure is FSH and a little bit of LH. And we have both of these hormones in our bodies naturally. And when we're administering these into our bodies via an injection, it's putting a little bit more into our system to help us recruit several eggs and mature eggs, which we don't normally have several mature eggs during our natural cycles. So that's really just that's the goal of it, just so you're wondering, why am I taking this? And that's always important to know the why. I think it helps. It helps you to understand. The other part of Menipure is, where do I inject it? Menipure is injected into either the lower belly, lower abdomen, or the upper top, upside outer thighs. That's routinely where we have our patients doing that injection for the fertility clinic I work with. And I think most often that's where most everybody is as well. So the injection goes in the lower belly and or the upper outer thigh, which is a subcutaneous injection. So those injections, you have an option of either self-injecting or someone gives you the injection. And that option, again, is yours. It's not one that it should be your individual choice to figure that out. We want you to feel comfortable with administering this medication. So if you are able to administer your own medicines, great. If they concern you to do that and you want to enlist the help of a significant other, then that's fine too. Do whatever makes your fertility cycle journey the most comfortable for you. So with regards to Menipure, where the supplies that you will need for that is going to be, you will need vials of Menipure that contain a powder or a tablet or a wafer. You know, everybody refers to that a little differently, even amongst nurses, but just so that you know, you will have little vials that'll have a powder or a tablet, and that will be what's in this box that you have of your Menipure. And you will also need to have a Q-cap, which is going to be supplied with you as well. Pardon me for having that upside down, Q-cap. So you need one of those for this medication. You also will need a 3 cc syringe. If it has a needle on it that is long, then you are going to remove the long needle. Just depends what you might get from the pharmacy. They may send you a syringe without any needle in the package, and that's great. That's what you need because this is a 3 ml, 3 cc syringe. But if it has a needle attached that's very long in length, remove that needle and discard it in your sharps container, because you do not need that long needle for this. Remember, I said this is a subcutaneous injection, which anytime you hear that buzzword or a belly or a thigh shot, that means that it's a tiny injection needle that you will be using to inject with into your body. And then lastly, what you'll need is a 1/2 inch needle. The pharmacy might send you either a 27 gauge or a 30 gauge. Just so you know what those 27G and 30G mean. The higher the number just means the thinner the needle. So the idea here is oftentimes for subcutaneous injections, most commonly it'll be a 1/2 inch needle and a 27 gauge. And usually that has a gray outer little labeling system on it when you get it. Once in a while, the pharmacy might send you a 30 gauge, and that's fine to use too. So there's flexibility with some stuff, and where there is, we want you to know it's okay. But if you're ever confused or you ever have a question, obviously your nurses at your centers are always there to help answer any of those questions that you might have about your Menipure supplies. So once you get your supplies, our next thing is to, again, mixing and administering a medication is not a sterile technique, but it's a clean technique. So it's a good idea to wash those hands. Use a little hand sanitizer if you're not near a sink. I'll just use the hand sanitizer for showing you to make sure that you do know that it's always good to clean those hands. And when you have everything set up, then you're ready to go. So the first thing that we would do with our Menipure is we would have to know our dosage. Your dosage that you might get from the nurses, they may refer to it as you're going to mix 1 powder or 2 powders or 3 powders. We just find sometimes it's easier for patients to understand that, since the 2 types of vials you'll have are powder and or water. So what you want to know is that she will tell you how many powders, but she may also give you a number. With Menipure, each powdered vial is equivalent to 75 units. So if you're a patient that's taking a 75 unit dose, you're mixing 1 powder. If you're a patient that's taking a dosage of 150, you're mixing 2 powders. I think the other thing I've always gotten asked about that, is it 2 shots? Nope, it's not 2 shots. It is simply 1 injection, but the strength of that shot is 2 powders. So that's what's important just to know right off the bat. Don't worry or get concerned or panic that you have 2 shots because you're doing 2 vials. It's 1 injection of Menipure, but your dosage could be a little less or a little more. And what determines that is your doctor at your clinic, based on your history, your diagnosis, and your plan, your age. All of these factors go into effect in coming up with a protocol of which medicines, what dosages, etc. So if my dosage, and I'm going to show both. If I were 75, 1 powder, or 150, 2 powder. So first off, what I do is I take these little plastic tabs that are on top of these vials and I remove them. Okay. Under there, it is sterile. However, like I say, the nurse in me is always wanting to clean the surface of anything that I'm sticking a needle into. So I'm going to clean the surface of these vials for us so that we get ready for our mixing. So we'll clean them, put them down. The next vial you will have is a vial of sterile sodium chloride. You take off that little cap. Once again, get a little alcohol prep pad, clean the top of that. So first thing you're going to notice is I'm only taking 1 vial of water. The ratio, how I always say it to patients, no matter how many vials, how many powders, what number of Menipure you're mixing, always 1 vial of water, sterile saline, sterile water, to however many powders you need to mix. And it's always 1 shot. That's the key. So 1 shot, 1 water, but the variable is the number of powders that you need to mix for your dosage. And that dosage could periodically, potentially through your cycle, need to be changed and adjusted based upon your response to your cycle. So just know that this is a variable, but your nurses will guide you every time in telling you what you need to take and how many vials you're mixing. The next step is going to be to grab your syringe, and you're going to open up your Q-cap package, and you will twist your Q-cap onto the syringe. It threads right on there and it twists. Our next step is going to be that we're going to go into this vial of sterile water, okay? In the vial, we're going to draw up 1 ml. There's a little pressure in that vial when it's new, and it can make it a little difficult sometimes to draw down. The pressure will push on the plunger. So a way to handle that is if whatever you're drawing out of the vial, you inject that amount of air, it'll help equalize that pressure. So draw back to the number 1, lining up the rim of the plunger just on that number 1 line. The Q-cap just gently pushes down on the top of the vial. Turn it upside down, and you'll see when I push, it's going to bubble. And then when I let go, you're going to see that it pushes down on my plunger because of that pressure. But eventually it stops because I did that little tip of adding the air. So what I want to do with this vial is I want to draw up 1 ml. So I would draw down to the number 1, filling it up with 1 ml. One thing to let you know about your Menipure is you will always have extra water when you draw up the 1 ml because they put 2 mLs per vial of sodium chloride sterile saline. So what you want to know is if there's extra water in here, that's okay because you're only drawing up to the 1. Once you draw up to the 1 and you have it in the syringe, just wiggle that vial off and discard it. Do not save these sodium chloride vials, not necessary. You have enough in your supply with your prescription. So that can go in regular trash. You will take your first of your powders, attach the Q-cap, push down on the liquid. When that water hits that powder, it's like cotton candy hitting your mouth. It melts. So that little powder and that little wafer just dissolves. You can roll it around gently, but don't shake. You just want to reduce the bubbles. So you gently roll it around, keep the needle attached to it. Once it looks like it's all mixed, you're going to drain, drain, drain all the way down to that 1 ml. So I'm going to drain all that fluid that I just mixed in there, which is 1 ml went in, 1 ml comes out. Now this vial is empty. I do not save it. There's nothing I need it for. So I will once again toss in my regular trash. If I were doing a dose of 75 units, 1 powder, now I'm actually done. I do not need to mix anymore. I would take this Q-cap off and attach my injection needle. But because I want to show you also how to mix 150, if you're doing 75, you would take the Q-cap off after mixing 1 vial and we would put on the injection needle. But if we still need to mix 1 more vial because our dosage is 150, 2 powders, then we're going to cape that same syringe with that same liquid, which has one of the vials of Menipure dissolved already, and push both powders together now with that 1 ml. Roll it around, let it mix, draw it back up. And here's where, when you're done with your mixing of your number of powdered vials, all you need to do is twist off the Q-cap with the vial, and that can go in regular trash because no blood has come in contact with that. You will then take out your little 27 gauge 1/2-inch needle to inject. If I had any bubbles, I give a little snap to the syringe, and that helps the air rise to the top. But if I don't do that step, is there anything wrong? Absolutely not. And I just want to help you right away, because this is a mixing medication. Please don't panic about air. Air is more of a concern when you're in a hospital and I'm taking care of you and you have an IV going directly into a vein. Yes, air if you can, and you see a little bubble, you can always flick it. But there will be some little air bubbles you can't remove. And I don't want you to start pushing the medicine and letting it squirt and you're losing valuable drug. So the little bit of air is never going to hurt that little fatty tissue, FYI. Just know that, so that you don't worry or panic if you have an air bubble there that won't move. Like I mentioned in the very start of the video, the injection area that we used for this is our lower belly or the upper outer thigh and top thigh. So all in here. And with Menipure, because you will take it more than one injection, you'll do approximately 7 to 10 of these injections. It's just good to know that you can move around in that belly every time you give an injection. You move it around a little bit. You could then also incorporate using the thigh and do the thigh as well. So some ladies will do just belly shots. Some ladies will stick with their thighs, or some ladies might combine both. No right or wrong, whatever works for you is fine by us, as long as the medication, you have the right dose and the right area that you're injecting. With this medication, like I said, you could self-inject or somebody could give you the injection. So if somebody is giving you this shot, you could lay down. And when they're giving you this injection, the needle goes in at a 90-degree angle in your belly, a 90-degree angle in the top of the thigh, and a 90-degree angle into the side thigh. It's a 90-degree angle. If this were me right now and I'm standing and I'm giving my own injection, if you do give your own shots, which you can, then standing up, the injection 90-degree angle is just like this, the angle straight in. So what we do to get ready for that injection is we clean the area with a little alcohol, just clean that skin. Next step's going to be to pinch and have a little bit of fat. With pinching, be careful that you don't over pinch. I'm just going to show my arm here. When you pinch that fat, lift it a little bit gently. Don't squeeze and grab so tight. If you do, you might bruise, and you just don't want to have a bruise there. If you do get a bruise, some people can bruise from an injection. Don't worry. Just avoid going into the bruise when you give a new shot. It's not uncommon or unusual to bruise when you get your blood drawn or even given a little shot. Not to worry. It's just you want to avoid going into a bruised area to further cause any trauma to that area. So what we do here is we uncap our needle, gently pull it off. We're going to give that little pinch to the skin here. The needle goes in straight in. We do not need to jab. Once we put it to the skin, we're going to give a little push, and it goes all the way. We let go of the fat, and then we push that liquid right in. And then can do a 1, 2, 3 count, remove the needle. And then what you want to do here, guys, is if your sharps container is nearby, you don't have to recap a dirty needle. You can put it right in the sharps container and then put the cap in there as well. But I'm just going to be safe for me right now and just cap it so I don't have a dirty needle lying around, since I don't have my sharps container. But you would put this into the sharps container. With Menipure, you're never reusing any of your supplies to the next shot. Every night you do a shot of Menipure, you gather new supplies and you use all of those supplies up, and then the next night, new supplies. So nothing is ever left over with a Menipure shot. One last little thing I will mention about a Menipure injection is sometimes you may feel a stinging sensation when the liquid goes in, and there's nothing that you did wrong with that. They do use sodium chloride to mix the powder to dissolve it, and sometimes that's just a little irritating to the fatty tissue because we have a lot of nerve endings there. So if you ever feel a little sting, don't panic with a little tiny injection. You've got a lot of, think of a paper cut. Even though it doesn't sometimes go very deep, a paper cut's really sensitive when you get it because of all those nerve endings in that little fatty tissue. So same with the belly. It'll be very fleeting when you feel it, but when that medicine goes in, you definitely can feel a little bit of a sting. And if some of your other medications didn't have that sensation, you might question did I do this right? And I just want to reassure you that indeed you did mix it correctly. It's just that that's the nature of that medication sometimes when it goes into the body. So I hope this video is helpful for you, and hopefully you will get started with your Menipure and be successful with your mixing, but certainly understand, give it a little bit of time. The first night's the challenge, and then after that, you'll become a pro at your mixing of your Menipure. Hi, everybody. So we're back after the Menipure video. Hopefully that was very helpful to you to be able to see and watch that in mixing technique. I think sometimes this is one that we do get asked a fair amount of questions on because of the mixing. People get afraid of hearing mixing. And so sometimes what I always like to say, and I know I mentioned it several times in the video, but it is always a big reminder, is it's never going to be multiple shots of that same drug, Menipure. It's always going to be one injection. So I always use my analogy of we could both get a small cup of coffee, and my coffee could have 1 sugar and your coffee could have 2 sugars, but it doesn't change the volume of the 1 coffee. So the idea is that, you know, we both can be giving an injection of Menipure, and you might be mixing 2 powders and I might be mixing 1, but it's just the dosage is really what is the key with that. So that is probably one of my bigger things that I know does come up sometimes when people have to mix multiple vials. Craig, I don't know if we have any questions for that medication from anyone.
Yes, we do. All right. So we got a bunch of great questions have already popped in. And so just a couple of things for everybody out there. Remember, if you're joining us on Zoom, you can just type the questions right into either the Q&A section or directly into the chat. Either one of them we will get to. And obviously, if you're watching on Facebook Live, feel free to just throw your questions right into the chat and we will definitely get to those. And just like this question that came out. So this question asks, what are the benefits or drawbacks of using Menipure alone versus FSH in my treatment cycle, if there are any at all?
That's a good question. And so with fertility cycles, in the part of the cycle that you are recruiting multiple eggs, generally speaking, there are different products that can help individuals with their stimulation. And they usually contain, though, either FSH, follicle stimulating hormone, or luteinizing hormone. And we do have both of those naturally occurring hormones in the body. Sometimes what I see is if something might be preferred, if somebody might benefit from the Menipure because it has a little bit of both versus one of the products that's pure FSH. Oftentimes, most centers, most clinics might be using a combination of the FSH, LH. And there could maybe be, for some reason, potentially a person's history gynecologically, or if they have a hormonal issue, that there might be a need for purely one product or one hormone. That might be the only time. But for the most part, with that recruitment part of your cycle, you usually will see that you'll have FSH and LH. I think the biggest thing that I would say as a patient is your dosage. Your dosage is what is determined for you by your clinic with your nursing and physician team. And that's more what's important, because the idea is the doctors would like to have you be on the lowest dose possible, but to provide the best stimulation for you. And that's where we all differ. That's where each of us has a different age, a different diagnosis, and a different history coming into a practice. And that's where you need to have often a tailor-made cycle for you. So pure FSH versus FSH LH, it's really just a matter of knowing the specifics for that patient with their history that really determines those decisions. And that would be your clinic responsible for that.
Perfect. Thank you so much. I know one of the things that was obviously a question. Sometimes people just want to have questions about how's the product work or why this versus that. And I know we talked about, we're going to try to get as specific as we can without really stepping on the toes of like your specific treatment plan that you might be having at home. But other times people just want to have questions about, giving the shot itself, or if you miss a shot or something like that, just some of those things that you want to get them out of the way now, so you don't have to worry about them later when you're about to give that shot. And just like this next question that comes in that says, what happens if I miss my dose of Menipure for the evening, or if I accidentally, for example, give too many or too few 75 IU vials on a given day? What should I do? Is there an option?
What I would say to that, Craig, is what the patients should do is definitely contact their clinic. There are times sometimes that patients will have an issue when they're at home doing their medication. And I think the biggest thing is never be worried to hide behind a mistake or what you may perceive as a mistake or an error, because oftentimes we are able to, at the clinic, maybe we would check in on you a little bit sooner. Maybe you were, for example, maybe you weren't going to be seen for 2 days from today, and you took a dosage tonight that might have been what you thought was a mistake because it wasn't your exact dose. We might bring you in tomorrow for blood work and ultrasound. So oftentimes I think the biggest thing with that issue about missed dosages, maybe taking more dosage, is to definitely be upfront and open and honest with your clinic about that. And usually your team and your nursing team, they will develop a plan of either monitoring you sooner and maybe potentially changing or adding the dosage or making up for that lost dosage. And sometimes we do that as well. So that's where I think just communication is key.
Perfect. And I know one of the big things, we've talked about this a lot on the Pharmacist program, is that you're probably not the first person to have made any of these type of mistakes. Anything that may have happened, whether it's a missed dose or an extra this or something, and you'll get into some products that have like a very strict timeline around when you should use them, things like that. You're not going to be the first person. So that's why it's a great opportunity here to ask these questions now so you can get them out of the way, because very rarely are we going to have a situation where Wanda's like, I've never heard of that before. Like that's never taken place in all my time doing this. So that's what this is great for, is to really ask these types of questions, get them out of the way, but also to kind of put you at ease knowing that your team is there to help you through these types of situations. And that's why always be better to share that information with them as soon as you possibly can. So thank you so much, Wanda. That's an excellent answer, really, to help people feel a little bit more at ease in a situation that can be a little bit nerve-wracking. And speaking of situations that could be a little bit nerve-wracking, this situation has come in many times before. And I know you touched a little bit on the multiple injection sites and situations with like bruising and shifting around that. And this question may have been, kind of jump-started because of that point that you made. And it says, multiple of my various injection sites are getting tender and even a little bit painful. How do you recommend I work around this issue moving forward so as not to make it worse?
So I sometimes do think that patients feel that the area that you sometimes are working with might be a very small, very specific area. And that's why I tried to, on the mannequin, when I showed that video, give you a broad general area, and even with the thighs. So for subcutaneous injections, because there's a belly area and you have a good part of that belly that you can use, if there's one side of that belly that's bothering you, then don't do any shots. And it can be several days that you don't go over there. When we say move it around, we want you to move the injection, know that you have a fair amount of area within a site to use. So I think sometimes the issue here becomes is that patients get very focused on the site, and they think that there's not a lot of area around the site. And there is a fair amount of area around these sites sometimes that you can use. So if one thing I would say in that issue is, sometimes I'm a morning nurse at my clinic, so I do see patients at times who come in and they want to confirm that they're using the right area. They might show me a little bruise and I say, that's okay. It's completely normal that you have that. It does happen. Just don't even go near that area of the site, and only work with the one other side of the site. So again, don't think that it's so narrowly focused. Talk to your nurse about it. If you need to get seen, you can always come into the clinic. Oftentimes when you're coming in for your morning monitoring at a clinic, that's a great time to do that, and we can take a peek. But just know that usually, even if you have a bruise or a little area, we would allow you to stay away from that area, even if it's for 1, 2, 3 shots. Sometimes some people have a real sensitive side and they don't even use that side at all, and they'll do just one side of their belly and they move it around. That's great. We'll work with that. No worry.
Awesome. No, thanks for really, that's one of the things I think there's a lot of questions around the anxiety over just the shot itself, and really helping to put people at ease, knowing that, if you think of your needle almost just like a dart, the only part of the dartboard isn't just the bullseye, right? There's an entire dartboard. So use your whole dartboard. You have places to work with there. And that's where these types of questions are great, because we don't want people feeling like, oh man, I have to go back into the same spot because they told me I have to rotate and I'm back to that day again. You have a lot of different options to play with. So thank you so much for really, putting people's mind at ease there. And of course, if you have any other questions, follow-ups onto these types of questions, it doesn't just have to be, you could hear somebody ask a question that makes you think of a follow-up question, feel free to jump on. And that's what this whole program is for. So thank you so much for that, Wanda. So a question, and I know you talked about the mixing process, and there's the, like you said, the coffee analogy that you gave of coffee to sugar and cream. And This question came in that is, and we've gotten this a couple of times before. I know you've even talked about this, but is there any flexibility regarding how much liquid I should mix with the Menipure powder? I've heard somewhere, but I'm not sure if it's true. Does adding more or less liquid make the injection less painful or uncomfortable?
Okay, so that's a good question. With Menipure specifically, Menipure is a subcutaneous injection. So just sometimes out there, rule of thumb for us oftentimes is that when patients are mixing a subcutaneous injection, because it's fatty tissue and those little vessels are the absorption in that fatty tissue, we sometimes don't want to overwhelm that tissue when it's a little tiny injection. So oftentimes you might see that with your clinic, that's why they're using, like, they may have you mix a half an ml or 1 ml. So 1 ml, 1 cc, half ml, half cc. Sometimes you could go to 1.5 ml, 1.5 cc. But oftentimes anything really beyond that is going to be then something that's intramuscular, because that's going a little deeper. That's in that very muscular vascular tissue of the muscle. So what I would say to that is always, again, confirming with your clinic. But in general, if I was to answer that, that's why I'm just giving you like that standard of a half an ml, an ml or cc, or a 1 ml, 1 cc is usually subcutaneous, little needle going into that fatty tissue, because we don't want to overwhelm that fatty tissue for absorption purposes. When you go in a little deeper, then we can increase the fluid amount. So with the Menipure specifically, it's not going to change really your dosage. Is, remember, the powder. That's the medication, not how much liquid you're using. So if you ever did use 1.5 ml, maybe it could dilute it a little bit, but because you're using, remember, sodium chloride with that, which is sterile saline, it's still going to go in that fatty tissue, and sometimes you might feel it a little bit. So I haven't been asked that question. If I use a little more fluid, will it be a little less stinging? And not necessarily with that, in terms of that as being one of the solutions. So as always, I would want you to know that you should talk to your clinic and utilize the amounts that they're having you use for mixing your powder. But sometimes it's really the powder. I think that's the big emphasis that we always have to tell patients with that medication. It's the powder that's your dosage, not the liquid amount. The liquid amount is just dissolving that powder.
Great. Thank you so much for explaining that and for giving such a great answer to that question. And at this point in time, we have actually gotten through the questions that have come through. We, as always, want to make sure that everyone has a chance to get their questions answered. So don't feel like you have to rush to get it in before we move on to the next product, because you'll have plenty of time to ask your questions throughout the course of this whole program. We open it up at the end for questions about any of the products that we've talked about, and any kind of tangentially related questions as well. But in the meantime, if somebody is trying to get that last question in, let's just give another 30 seconds or so for them to type it in, and I'll throw it back over to you, Wanda, just if there's anything else you wanted to share before we get ready to move on to the next question, if somebody is trying to get a question out there.
So with Menipure, what I just would want to emphasize is don't be intimidated by the mixing process. I think it's real important that you just know that watch the video a couple times if you have to. Take it slow the first night, but you really will get into your own system and your own little groove, if you will, with your mixing. So at first, I think that is the biggest intimidation factor with a mixing product. But really, once you get that one night of mixing down your belt, I think you feel a lot more comfortable with the mixing. So don't be afraid that the Menipure is the mixing medication. It is, but it's definitely something that, as you could see with that video, just knowing the steps and watching the video with your steps and your supplies is, I think, the biggest thing you can do to make that a much simpler process.
Hi, everyone. My name is Laurel Meyer, and I'm an IVF case manager in California. Tonight, I'm going to share my story of my infertility process in hopes that it helps you have the courage and strength to go through your journey. About 25 years ago, my husband and I started having trouble getting pregnant. We went to an infertility specialist and had a workup. I wasn't ovulating regularly. I knew this because I wasn't having regular periods. And my husband's semen analysis was fine. So we started on a treatment called Chloride. We started with 50 milligrams and had to keep going up every month because I wasn't ovulating. So we went from 50 milligrams to 100 to 150, still no ovulation. And by the time I got to the 150 dose, I started having nystagmus, which is a blurry, shaky vision. It's a very uncommon side effect of Clomid, but it means you have to stop. So no ovulation anyway, wasn't doing me any good. So next step, hysterosalpingogram. This is the dye test that checks to see if the fallopian tubes are blocked. Sure, it's not a fun test. I'm sure many of you have had this test. It causes a lot of cramping. They put a tube, a catheter in through the cervix, and they instill dye, and they can watch the dye by X-ray travel down the fallopian tubes to see if it spills out the end or is blocked. In my case, they found that one tube was blocked and it had ballooned up like a sausage. This is called a hydrosalpinx. Now, in a hydrosalpinx, obviously the tube is completely blocked and doesn't work. My other tube was open. And thinking back to my teens, it made sense. I had been sexually active. I had contracted a case of chlamydia, which led to pelvic inflammatory disease, PID, and the leading cause of a hydrosalpinx is from PID. With pelvic inflammatory disease, the cilia that line the fallopian tube get damaged. So even if your tube is open, the egg still can't travel down the tube effectively to meet up with the sperm. So even if I had been ovulating regularly, which I wasn't, I still wouldn't have been able to get pregnant. So the next step was to remove my tubes. This requires a surgery called a laparoscopy. The surgery found quite a bit of adhesions. And so they removed both fallopian tubes and the adhesions. Next stop, IVF. I needed IVF at this point with no tubes. So we did 2 cycles of IVF. Both times I got a low number of eggs. I got not very good quality embryos, and unfortunately, I did not have a pregnancy. The third cycle of IVF, we decided to use donor eggs. And the only way we could afford to do this process is to split the eggs with another couple. So the eggs that were retrieved from the donor, we split with another couple. We got one not very good quality embryo. And as a last-ditch effort, we decided we would go ahead and transfer it, knowing that it probably wasn't going to work. And lo and behold, it didn't work. Negative pregnancy. Now, to add salt to the wound, the other couple got pregnant. This was hard news to hear, but we asked the clinic for this news. They gave it to us in an effort to be transparent, and I appreciated their transparency. I think it's important to be transparent as a clinic as long as you can protect confidentiality. So with this, at this stage, we were pretty devastated. However, the same exact day that I had received this negative news, there was a woman who was in labor at a local hospital. She was single, she wasn't ready to be a mother, and she wanted to find parents for her baby. The next day, the following day, a good friend called me, and it happens that this friend was the patient's labor and delivery nurse. She knew that our last IVF cycle was long shot. So the first thing she asked us when we got on the phone was, did the IVF cycle work? We told her no. So she told us about her patient. She said that her patient had just delivered her baby. She was single. She wanted to find parents for her baby. She had not made any plans to do this. And our friend had told her about us. And now she wants to meet us. We were beyond thrilled. Oh my God. we rushed down to the hospital and we met her and her baby and we talked. We had a lot in common. We both liked big dogs. We both liked hiking in the mountains. We both liked reading a lot. And I had my biology degree, and she was working on her biology degree, still in college. She chose us to be her baby's parents. We were amazed and thrilled. So the next step, we had nothing prepared at home, nothing. We rushed out to Target to do the shopping. We tried to think of everything we could possibly need. Diapers, wipes, bottles, formula, blankets, onesies, a bassinet, and don't forget the car seat. We figured we'd forgotten something, but as long as we had the car seat, we were good for now. We barely slept that night and just fear that it would all fall apart. The next morning, we went down to the hospital and we brought our baby girl home on Valentine's Day. So this is her when she got a little bit older. This is our little baby Megan. Well, the story doesn't end there. Fast forward 2 years. We wanted to expand our family. So to do that, we called the IVF center, thinking that we may want to be the recipients of an embryo that had been donated to the clinic and do a frozen embryo transfer cycle with that embryo. The clinics told us that unfortunately they had a 2-year waiting list for this process. So with nothing to lose, we decided to put our names on the list and move on. Now, adoption, we were totally comfortable with. We had done it before. It had gone very smoothly. How hard could it be? We'll just adopt again. We could not be more wrong. It was not as we had planned. So to get started, we created an adoption letter that would tell potential birth moms about us, about our family. It was detailed with pictures of our family with our baby. And it told prospective birth mothers how we would be the most perfect family for her baby if she wanted to find parents. We sent this out to OB offices, friends, family, attorneys, anywhere we could think of that people could just tell our story in hopes of finding a lead for a birth mom. We also hired an attorney. We wanted him to help us find a baby if possible. And then when we did, he could do the adoption process, the legal adoption process for us. Now we waited. It was about 8 months later, we finally got a lead on a pregnant woman who wanted to find parents for her baby. She was incarcerated. So we went down to the prison to visit her. We talked, and she seemed genuine about wanting to find parents for her baby. And she chose us to be her baby's parents. She was pregnant with a baby boy. It was pretty early in our pregnancy, so it was a very long wait. But we had such faith and hope, and we were so excited about having a little baby boy. So we stayed in touch. We visited fairly regularly. We sent care packages with essentials and goodies. And finally, the day arrived that she delivered. We got the call from the hospital social worker, and she had delivered a healthy baby boy. We were so excited, but there was a glitch. The birth mom had changed her mind. She decided to keep the baby and let her mom raise it until she got out of prison. We were devastated, beyond devastated. We had been waiting and longing to bring our little baby boy home. We had the rug just pulled out from under us. We felt so deceived. We definitely went through the 5 stages of grieving. First stage was just, we couldn't believe that it happened, denial. This couldn't be happening. Why won't they let us talk to her? Why won't the social worker just let us talk to her? We'll just work this all out. There must be a mistake. Then we went through anger. What the F? Like, how could she do this to us? That was like the lowest of the low. She must have planned this all along. She just used us for the perks. We felt so devastated by this just, it was as if she just planned it from the beginning and was using us. And we were so mad at the attorney and her. The next step was bargaining. Well, maybe there's just, maybe she just needs a little more time. Maybe if we could just talk to her, we'll all work this out. She just needs more time to make a decision, and then she'll give us the baby. Well, the next step is acceptance. And I can tell you that took a very, very long time. I did finally get to the point where I forgave her, but I would never, ever, ever let myself go through that again. It was way too painful. So with that stage over, we waited. And a couple months later, about 1.5 years into the process of trying to expand our family, we got a call from the IVF center. They called us a little early, and they had embryos to offer us. We were so excited. The embryos had been created from a couple who had hired a birth mom. Who had hired an egg donor. The egg donor, they used the egg donor's eggs and the husband's sperm, and they had a successful pregnancy and birth, and they were done creating their family, and they donated their embryos to the clinic. And now they were offering us these embryos. The egg donor was a dancer. The husband was a computer programmer. So these embryos were both athletic and smart. We were thrilled. So we went through a frozen embryo transfer process. The medications were fairly easy. I was still pretty nervous that it wasn't going to work, and I was still quite fragile from the adoption fallout, but I was hopeful. I was very hopeful. So they transferred 2 embryos to my uterus, and then the wait. And oh, what a wait. That time between the transfer and getting your pregnancy test results feels like an eternity. I tried to distract myself with TV shows, movies, reading, hiking, whatever I could do, but it was still hard. We finally got the pregnancy test results, and they were positive. And then a couple weeks later, we had the ultrasound, and there was 1 healthy fetus. I absolutely loved being pregnant. I was nauseated, and I didn't mind at all. I loved feeling her kick inside. And it was just the most wonderful time of my life. At that point, I was the happiest I've ever been. I had a beautiful little girl who was 3. I had a loving husband, and I was pregnant with our second daughter. I delivered her on 4th of July. So now we had 2 holiday babies, Valentine's Day and 4th of July. And here they are when we got her home from the hospital. That's Megan and her little sister, Sydney. So it's been quite a journey. They're growing up. And the reason I tell my story is I just want to help make it a little bit easier for you. I know many of you are going through a really hard time right now. You wish you were already pregnant. The waiting and not knowing is very difficult. But I want to remind you to keep the faith. You can do this. Here they are, growing up. And now my 2 daughters are 16 and 20 years old. Neither of them are genetically related to us, and we're glad they have this in common. It's something that I think can bond them in a certain way. But they know that they are loved 100%, and we're behind them 100%. We've been open with both of them on their birth stories, and they've both had their struggles, as we all do, but they know that we are there for them 100%. So I hope in hearing my story today that it gives you just a little bit more strength and courage to continue on in yours. I know that for me, just taking it one step at a time, keeping the faith and staying positive was helpful. And I know that if I can do it, so can you. So good luck, and thank you for your time.
First off, I would love to thank all of our amazing nurses for being a part of the program, all of these excellent conversations that they've been able to have, and all the great information and expertise that they've been able to share with you. I especially want to thank Laurel for that very personal story that she shared and really drive home the fact that there's tons of different reasons why people are in this space, and they're all here to support you and everything that you're going through. As always, all of these different videos, including this one and the best of that we put together, will be available on all of our different websites. So you have our YouTube page, our Facebook page, and of course, our homepage, the mymandellspharmacy.com/PharmAssist page. You can find all of the individual websites, product walkthroughs, as well as the larger picture, the entire videos that you've seen tonight. We will be back next Monday at 7 p.m. Eastern Standard Time, and we're very excited to continue this program with you. We look forward to the interactive questions that you bring to it, which is the part that makes this program so exciting for us, and we're very excited to bring that information back to you. We hope that you're able to learn something throughout this program, and we hope more than anything that if you got something out of this, that you can share this with somebody that you care about, whether it's a family member, a friend, a colleague, a close associate, somebody that you bumped into at Target. There's somebody somewhere that needs some of this information just as much, if not more so than you do. And we really, really ask that you share this with them. So with all that being said, thank you so much again to our nurses. Thank you for joining us and for being a part of the program. And we hope to see you here again next Monday night at 7 p.m. Thanks for being a part of the Pharmacist program. Have a great night.